I'm Jacqueline. I am 5'8" tall, and at 220 pounds, I think I have finally stopped gaining weight, but only because I have finally stopped trying to lose weight. I had 4 babies in 6 years, but I don't think the baby weight is the reason that I am currently in the BMI category of obese. In fact, I think it's because I tried so long to lose the weight that my body is the way it is now. I am not alone in being unsuccessful with long-term weight loss. In fact, research shows that only 5 to 10% of people who attempt to lose weight are successful at keeping it off over the long term. Obesity is not caused by individual choice, but by a confluence of social, environmental, and most significantly, genetic factors. Despite this evidence, we live with a cultural narrative that weight loss is easy and weight gain is a choice. Those with bodies larger than mine face even more discrimination and abuse. Doctors are not immune to this anti-fat bias. I understand why it makes sense to doctors to recommend weight loss because of the correlation between higher BMI and negative health outcomes. But this correlation should not be treated as causation. The BMI was not created to be used as a measurement of health, but for the purpose of evaluating and comparing populations. Because it was created to look at body size at a population level, it doesn't take into consideration that on an individual level, a wide variety of bodies can be healthy at a wide variety of sizes, metabolically healthy even. Despite this, the BMI continues to be used as a diagnostic tool for health. When doctors focus on weight as though it is something their patient can and should control, all they succeed at doing is shaming the patient and communicating that they are not at all curious about how the patient got to be the size they are in the first place. Eating disorders often go undiagnosed in larger patients, and in fact, they are often praised for the disordered eating that is making them significantly less healthy. Many obese patients report going to the doctor for one thing completely unrelated to their size and being told to lose weight, regardless if it has anything to do with the problem they're having. I ask you to consider whether misdiagnosis, shame, and a lack of trust in the medical system may be a contributing factor to the high mortality rate faced by obese people. This is not to say that a doctor can't encourage a patient to change their lifestyle choices to benefit their health, but rather to ask that the recommendations they make are specific and actually attainable. All the interventions you would recommend alongside weight loss, medications, exercise, nutrition, psychological interventions, all are beneficial even if the person stays the same size. So next time you consider asking your patient to lose weight, maybe think about what positive outcome you're hoping will result from that weight loss and focus on how to achieve that outcome without weight loss instead. For example, if you're hoping for lower blood pressure, what can be done about that specific problem if the person stays obese? The medical research shows that the causes of obesity are complex and individual, that at least 90% of people who attempt to lose weight fail, and that anti-fat bias is real and has a lot of harm caused and exists in doctors' offices. Given those facts, why do doctors continue to tell their patients to lose weight? What other treatment would you recommend that has a 90% failure rate and a risk of causing mental health harm? For me, personally, I have finally disconnected exercise and nutrition from weight loss. I now exercise regularly with the short-term goal of being cheerful and the long-term goal of growing old, all while accepting that my body size is not evidence of a defect in my character. I just hope that next time I go see my doctor, he doesn't ask me what I'm going to do about my BMI, but instead focuses on the specific problem that brought me to his office in the first place.